going to talk to you about a very common symptom, that is fever. We all know that there is hardly any child who doesn't get a fever once in a few months till he is 3 to 5 years of age. And that is the time when the parents become panic whether how to measure the fever, where to measure the fever, what is the normal range of temperature, is my child having high fever, like that. So, we will try to see a little details regarding these things. First of all, what is fever? Fever is defined as a controlled increase in the body temperature of a person compared to its normal in a given setting. That means the normal value, we all know it is mentioned as 37 degrees centigrade, that is inside the mouth. But is it a single value or is there a range? Yes, definitely there is a range. It is from 36 to 37.5 is considered as the normal range, provided you are measuring inside the mouth. And when the temperature goes above 37.5 only, you will call it as fever at all. Because sometimes parents ask, my child is having 37.3, is it fever? No, it is not fever. Now let us see how do we measure the temperature properly. We have 5 sites to measure the temperature. The most important is the rectum. The rectum, it is showing the core temperature. So what is core temperature? It is nothing but the temperature inside our body. That is the temperature of the blood. And this is the temperature which determines how effective the metabolism is, how we are going to destroy the bacteria, and even how the complications of fever occurs. Everything depends upon the core temperature. So, whether you are measuring the mouth or whether in the axilla or the ear, always try to convert to the core temperature. I will tell you how to later on. So, the normal core temperature is 37.5 degrees, that is 0.5 degrees higher than the oral cavity temperature. And the temperature of 38 degree or above in the core only is told as fever. So, what are the advantages of this measuring the rectum? The advantage is that it is most accurate and it is useful in small babies like neonates and in very sick people to get the exact temperature. Always we depend upon the rectal temperature which is measured in the anus. But what are the disadvantages? The number one disadvantage is the problem with measuring. As we know, you and I would not prefer to have our temperatures checked from backside. So that's one. And secondly, if there is too much loaded colon, like with fecal impaction or local inflammation, then again the temperature will vary. So what is the second best site? The second site is the oral cavity. We all know oral cavity is the preferred site for adults because it is easily accessible and it gives reasonably good temperature. But there are also some problems here. That is, we cannot use the oral cavity for small children below 4 to 5 years. The number one reason is children will not be able to cooperate to keep the thermometer in the mouth for 2 to 3 minutes. And if at all, they may sometimes bite the thermometer and even end up in mercury poisoning. But for adults it's okay. But and another 2 or 3 things are like if we have taken a high temperature liquid like hot tea, or if you have taken a very cold juice, something like that, or ice cream, then definitely it will affect the temperature measurement inside the mouth. The third preferred place is the axilla. The advantage is it's very easy. The mother can hold the thermometer within the axilla by compressing the hand. But the disadvantage is that it will be around 0.5 degree further below the oral cavity temperature. That means it will be 1 degree centigrade lesser compared to the core temperature. But and also in addition, if there is too much sweating or if there is too much overclothing, this will affect the temperature measurement. Then the other 2 sites are relatively new concept, that is on the forehead and in the ear. The advantage of forehead thermometer is that it is very fast, it is very quick, it is very convenient, it is non-touch method. As you know, it is the best thermometer for screening purposes. Nowadays we are seeing it in the airports, in the malls, everywhere everybody is using, and it looks like this. It is convenient, placed around 1 inch 2.5 centimeter away from the forehead, and you just need to press for a second, that's enough. And the fifth, the last and not the least, and actually the most useful one is the ear thermometer. Ear thermometer is something like this, and the advantage is that it's very convenient to use, and this we can use from a wide range of age group right from 3 to 6 months of age to adults and even old age we can use this. And the advantage, another advantage is that it is showing us almost near the core temperature. The ear temperature will give almost near to the core temperature. And but there are some disadvantages for this also, like if there is too much wax or if there is too much infection in the ear or discharge, then we cannot use that ear, but we can use the other ear. But what is the normal temperature in the ear? Normal temperature here, as I told, is like 37.5. So it is similar to the rectal temperature or core temperature, provided you are using a standard thermometer which is calibrated. Now let us see how to measure the temperature in the ear cavity. So first thing is we have to explain the procedure to the parent or even to the child if it's a bigger child. We are measuring only and it will not hurt him. Otherwise, children may suddenly shake the head, they will get irritated and they may injure the ear. So first of all, hold the pinna of the earlobe and pull it slightly backwards and upwards like this. Then you can introduce the probe gently so that it goes almost up to the inside of the ear. Then only press in the button for measuring the temperature, and it will be done very fast. So in nutshell, we have 5 different sites for measurement of body temperature, and of this the rectum and the ear gives the core temperature, and always try to convert, if you are measuring the mouth also, try to convert it by adding 0.5, you can get the core temperature. If you are measuring the axilla, add 1 degree centigrade, then you will get the core temperature, because the further description all comes in core temperature. For example, the temperature from 37 to 38 is considered normal if you are measuring in the core temperature. Similarly, 38 to 39 is a mild fever, and 39 to 40 degrees centigrade is a moderate fever, and above 40 degree only it is called as high grade fever. So now onwards you can be assured that even if you are seeing 37, 38, 39, it is not a very high temperature, provided you are measuring the core temperature. And with keeping this in mind, from next time onwards you can be more confident in measuring the temperature and interpreting the values. Thank you.